Are you ready to be connected? You're listening to the Insured Connection podcast by Pica Group, a pro assurance company, where we provide expert advice for your practice when you need it most. We connect you with industry leaders to discuss timely topics so you can listen, learn, and get back to caring for your patients. Now, let's connect.
Welcome to the Insured Connection podcast. I'm your host, Dr. Ben Cullen, and today I'm joined by fellow PICA Medical Advisory Committee members, Dr. Dustin Kruse and Dr. Jeffrey Baker. In this special episode for Men's Health Month, we want to have an honest conversation about what it's like to be a male physician today. We're going to touch on things like mental health, work-life balance, medical legal pressures, and how our personal lives intersect with our careers. We're going to explore why these issues are especially relevant during Men's Health Month and try to offer some insights into navigating these challenges in your practice. So before we dive in, let's get a quick intro from everyone. I'd like to ask you to share your geographic location, type of practice, number of years out of training, and a little bit about your family dynamic. I'll start. Again, Ben Cullen from San Diego. I got a small group practice with two other podiatrists. I'm about 13 years out of training, and I'm married to a former emergency room nurse, and we have an 8-year-old son and a 6-year-old daughter. Dr. Kruse?
I'm Dustin Kruse. I practice on the west side of Denver, Colorado. I'm in a small group practice as well with 2 other partners and 1 other associate. I am married as well. I have a 6-year-old boy and a 10-year-old boy, so they run me ragged quite a bit.
And Dr. Baker?
I'm Jeff Baker. I'm from Chicago, Illinois. I work for the Wild Foot and Ankle Institute, so I've been in private practice for the last 22 years at Weil. I started in 2004. So in a larger group practice, it's now into a very large group practice as a part of Balance Health. So one of the physicians that was a partner and now a part of a large group. I'm married to a podiatrist. My wife's a podiatrist here in Chicago as well, and we have a 7-year-old son.
Awesome. Thanks, guys. So we'll start with talking about something that we don't always talk about enough, which is mental health. So just to get the ball rolling here, what are some of the biggest stressors that you personally deal with right now, Dr. Baker?
So I think especially as a part of my intro that we're getting into an aspect where anybody in our profession is going to be involved with not necessarily working for themselves or working with others or working in some large group or working with a large orthopedic group or a multi-specialist group or a hospital system. It's sort of the balance of what we're expected because we work in the United States healthcare system in a for-profit industry of now hitting margins with still trying to do the right things for our patients. So it's this combination of like, I got to do the right thing for my patients, but I have to talk to people above me and supervisors and otherwise about hitting margins and things that make it the most stressful part of the job, I think, now. So there's some losing some autonomy. There's hitting KPIs. There's trying to do the best for our patients and give them the time they need, but not spending too much time with them. So it just all in one encompasses to burnout. And do you get burnt out from this combination? And I don't think that it's podiatry. I don't think it's surgery. I think it's just healthcare in America currently for all physicians and surgeons.
Absolutely.
Now, I think to piggyback on that, so from the smaller group practice side of things, it's, it's not hitting those goals and the KPIs and reporting to someone, but it's hitting our own personal goals and keeping a practice running. Especially in America and especially in Colorado where I'm at, where cost of living is exponentially increasing. It's been rough running private practice. So it's something that we're never really taught. It's all self-taught on the business side of things. And so trying to learn the business and run the business, and in fact, to mention, but I've been in practice 15 years now, and I've really seen it evolve and been in the same practice. So, that's, I think, honestly, the biggest stressor. And then add to that the ever-evolving documentation requirements and the amount of time we spend on notes and insurance authorizations. It's quite a lot. Patients ask me all the time if I love what I do, and I absolutely do. And, if I could just see patients and treat them all day long, that'd be amazing, and not have to worry about the business and, the documentation side of things.
Yeah, definitely. There's always new expenses that seem to crop up out of nowhere in San Diego. Cost of living certainly is up there as well. I'm kind of in a little more of a unique situation where I'm also the program director of a residency program. I'm involved in ACFAS and AO and run the local seminar. And so I'm kind of wearing many different hats. And so just kind of juggling all these different things. There's, my email box is like, fly swatter, like you try to like, handle a task and then there's always something right there behind it.
Yeah, this is a big concern because for male physicians, there's information out there in literature and research that you're at a higher percentage of potential suicide than the normal population, the generalized population. And this is just some of the burden that comes on with no matter what situation you're in. You're either doing it for yourself to have to hit margins, or you're having to hit margins for somebody else, and still try to keep yourself in terms of safe in terms of litigation, medically, legally. It's just a really tough kind of counterbalance to do. And it's really encompassing upon us as male physicians to not like live this life of being so stoic and, you can work through it and otherwise and do things to bring down that burden on you, if that's hobbies that you may have outside of podiatry or family or otherwise, but just to make it so that it's something that's truly livable for you when you're dealing with working in the office.
Do you feel like there's still kind of stigma among physicians about seeking help, or do you feel like that's kind of gotten better a little bit as time's gone on?
I would say I think it's gotten better. I think there's been a lot of improvement in state laws as well. At least in Colorado, we've changed it. So if someone is seeking help for any reason, it's protected information, whether that's substance abuse or mental health issues. So I think it's gotten better. The more that's out there, the more that people talk about it. It's important for us to say, I need some help, or ask for some help, whether, like Jeff mentioned, have hobbies or have partners that you can talk to. My partners, we have a really open relationship. So, we sit down, once a week and just kind of shoot the breeze after the day's over. And it's a good decompression for us. And so, find those outlets. It doesn't necessarily need to be professional help, but, friends, family, hobbies, so find an outlet is really paramount to keeping your brain functioning the way it needs to be functioning.
I think the help is out there, and going to seek out that help will never be frowned upon. But it's really the person. It's as things change for in your own mind that you can say, I'm okay with reaching out for help and even telling people I'm reaching out for help. And I think that's where it comes in, and especially in sort of us talking about Men's Health Month, and where it changes is thinking that this is something that you shouldn't do. And, lots of professions, it's this way now. I come from a firefighter family, and there was always this aspect of, you just keep these things in. And I think over time that has kind of changed, and you see things now that, are those of us that are in first responder and us in healthcare across the board, that it's not something that people are saying, oh yeah, you need to talk to somebody about this. That's second nature. It's not a big deal. And we expect it and almost want it to. But us as individual male physicians and surgeons, it comes down to you kind of saying that this is all right.
Yeah.
Kind of made me think of that Seinfeld episode where he says, serenity now, and serenity now, insanity later. The more we talk about it, the more we normalize it, definitely, I think the better off we all.
Definitely. Our job is to take care of patients, but you got to take care of yourself first. You got to be the best version of yourself to take care of the people that need you as well.
Absolutely.
Like what you're hearing? Go ahead and subscribe so you never miss an episode again. Now, let's continue to connect on today's topic.
Kind of shifting gears here, talking about work-life balance. Is work-life balance actually realistic in medicine, or is it more about trade-offs? In other words, how have your priorities changed over time, or how do you kind of, try to make work-life balance actually a realistic thing for you?
Let's see. So is it a realistic thing? I think it is, but I think it's more of a trade-off, like you mentioned, Ben. All of us are very involved nationally throughout several organizations, AO, ABFAS, ACFAS. I think the one thing that's probably hard for all of us to say is no when we're asked to do something. So we always want to keep doing more. There is an absolute trade-off. There's things that we miss in order to advance ourselves in our profession and advance our practice, advance our patients, advance our residents. So finding what's right for you is is one of the hardest things. I actually just said no to a lecture recently. It was one of the first times I've said no, and it felt really, really good. Knowing that I was going to have a little bit more time with my family, a little bit more time for hobbies and activities. So you got to find what's comfortable for you. And I have one partner who doesn't do much nationally. He's perfectly content and perfectly successful. So you don't have to say yes to everything. It's okay to say no, but it's very individualized. It depends on what your goals are personally and professionally.
That balance word makes it tough. It's like, how do you balance things? So, something on my end, and this may be different in every situation. And for your guys' situation, my situation in terms of this bigger entity sort of taking over the practice when I was a partner and having to be a little more intimately involved, like the two of you may be with your practice. I don't have to do it anymore, the day-to-day stuff. And just recently, and it's just one simple thing, but it makes a difference. I took my work email off of my phone. And so basically I'm like, I'm not going to look at work email really until I'm at work, or I have to open up a desktop to do it when I'm sitting down to do work, so that it doesn't just keep going and going and going. And there's many different examples of it, but from a personal aspect, I mean, it has changed things a lot. It's like, okay, and I get to work the next day and open up, and there's things that I have to deal with, but I'm just not going to deal with them off hours, when in actuality, in terms of my situation in my practice now, like there's nothing that's going to come through an email that's so emergent that I'm going to have to deal with, because I don't have people working under me otherwise and have to be on top of this, or someone not calling in and having to get coverage or otherwise, that there isn't a real work emergency. So it's finding something like that in everybody's situation that just gives you, and it's unbelievably surprising to think it's something simple like that, but it gives me 20, 30 extra minutes that I might deal with something and stop and do it, that I just don't do it anymore.
And, like water meets its own level. And, if you want to keep on working, you can work, in 24/7. But I think doing that, setting that boundary, I think is what really makes a big difference. For me, I mean, I only see my kids go to school, so I only see them when I'm at home from work. And so that time before bedtime, that's kid time, like basically I'm not doing work. If I have to, stay up a little bit later and do the charting after they've gone to bed, but kind of, setting aside dedicated time for things other than work, I think really is like the key here, right?
Yeah, for sure.
Yeah. Yeah. I mean, one thing I found is when I'm home with the kids and I'm being dad, I'm dedicated to that. And so I guess what you need to find, even if it's something else like sports, just find that it's not a balance, like Jeff said, but find where that seesaw can meet sometimes, and where the best, or be the best you can when you're there.
Try to hit that moving target.
Yes.
We kind of touched on it earlier, but in terms of like from a medical legal perspective, there is that reality that male physicians statistically do face a higher litigation risk. So first question along these lines is, do you think about malpractice risk on a day-to-day basis, or is it really only something that comes up when something goes wrong?
I mean, a bad way to say unique situation that I practice in Cook County, Illinois, which is known as like the most egregious litigation county in all of the United States. And so for that, PICA has done a great job with our practice to kind of get on top of these things. So we hear these lectures all the time. They're proactive about this because we're in an area that this is no different. Insurance is insurance. So our insurance premiums are up more because there's more lawsuits, and no different than having a car and living in an area that they have more stolen cars. You're going to have a higher premium. And so we kind of live it on that way about thinking about it. I've always been that way about being proactive instead of reactive for it. And it's going to happen to all of us. I actually looked this up knowing we were going to talk, because we had these things a little bit, but I looked it up, males versus females. It's for malpractice claims, male physicians 75 per 100 cases, and females are 42 per 100 cases. So it certainly is something not only just in general that you should think about that, and dotting your I's and cross your T's. The biggest aspect I feel on that, and you probably hear, is, do you think about it every day? I kind of don't, but I do, because I do good documentation. So it's in the back of my mind. I think that's the answer. Like, I'm going to document well on each patient. So it is in the back of my mind in a way. But even as male physicians, there's other things in terms of, just how we present ourselves that may end up looking like almost what we were talking about before about being stoic and otherwise, and just, just tough and that our empathy, compassion has to come out. And so, yeah, I definitely think about it every day.
Yeah, I probably wouldn't say I think about lawsuits every day, but I think more risk mitigation is probably the best way to look at it. As Jeff said, documentation. If you don't write it down, you didn't do it. So, focusing on documentation, making sure that what you're doing is appropriate, and, identifying risks of patients. I think knowing when to say no to a patient is a really hard thing for us to do as well, particularly surgery. Not every patient is a good surgical candidate in it. We've got to be able to turn those away. And then finally, the empathy part of things. As men, we tend to be less empathetic. It's just a fact. I think if we were able to say, I'm sorry you're going through this a little bit easier without thinking that we're admitting fault, I think it would help us. And there's studies that show, I think it's 43% reduction in lawsuits for doctors that say, I'm sorry. It's not admitting that you did something wrong. It's just saying, I'm sorry you have this complication, and let's figure out how we can make it better.
Yeah, the empathy part is key. That was told me a long time ago that it's not the inadequate or inefficient doctors who get sued. It's the ones who are mean to their patients. So the patient that if you don't care what people don't care what you know if they don't know that you care. Kind of try and have that as my mantra. Has fear of litigation kind of ever changed how you practice, other than the documentation side of things?
No, I don't think so. I don't. Stuff. I don't have a fear of being sued. I mean, I can be honest because anybody can look these up. I've been sued, so it's not like I'm saying, and there's not a fear of it. It's unfortunate that my answer back is going to be, it's the business of doing medicine, but you don't want to say that it's that way, but it is. But I don't think I'm not afraid, because it's in the aspect that I trust myself to do the things that I need to do in the best interest of the patient. So I don't think there's a fear. It still may happen, but I don't think I'm afraid of it in terms of that way. But I know that it's a reality. So I have to be like Dustin said, it's risk management of things.
Yeah, I wouldn't say there's a fear. Maybe there's an individual patient fear at times, when that radar goes off and say, it's whether you haven't done anything or you have done something and it's gone well or not well. Sometimes it's like, man, this patient I'm afraid they're going to get litigious with me. You can't necessarily describe what that is, but you just get that spider sense, and the hair on the back of the neck stands up. So, but I don't think on a daily basis there's a fear of being sued. Like Jeff said, it's going to happen. Complications happen to us. And, just because you have a complication doesn't mean it's a good lawsuit, but it can still happen just because of a bad outcome.
A lot of the times, like you said, to a certain extent, you can see it coming with certain patients. So just kind of, being proactive. And again, you're going to treat patients, the way you think they should. But again, the documentation might be more so heightened in those situations where you're aware of possible issues. If
you don't mind, Ben, to add into that. One, I was thinking about one specific thing, especially, and it kind of seems weird because people are going to say it's the one word that us as male physicians need to do better with our patients is listen. And anybody will say, well, we listen to all of our patients. We hear what they say. We document what they say. But it's truly the aspect of actually like listening to what they're trying to tell you and say, oh, understanding. And then that empathy comes from it. So if there's one thing I could give to this particular topic we're talking about, is just listen to your patients, And the other one, and Dustin brought this up and I forgot about it and it popped into my head, but there was a lecture at one podiatry meeting I was at, and it was by a plaintiff's attorney. And the plaintiff's attorney said that the one thing I can't fight against is a physician that right off the bat says that I'm sorry on the stand and actually admits. And they said it's very difficult for them to then try the case if the doctor said. So let's say sorry when you need to, way ahead of being on the stand, attorney, but I made a good point about that. That just reminded me of you saying that, Dustin.
Well, to piggyback on what you said about listening, I've been in situations where patients are like, I don't feel like you're listening to me. And right away, he said, I'm sorry you feel that way. How can we improve this conversation? What can I do to make this better? Patients, they're their eyes light up and they start talking and active listening going forward. And one of my residency directors taught me once is make little notes of personal things on all these patients. They're going on vacation. They, they like to do this. And when you see them next time, ask them how it is. And you develop a closer personal bond. And, with the patients, when they kind of look at you more as a person, I think you're much less likely to be sued as well.
Yeah. Great point.
And we all kind of live our life through our own sets of reality. So there's the patient's reality and then the doctor's reality, and you hope that they overlap. But your expectations for a procedure or treatment may be radically different from what the patient is. So the more you can kind of tailor to what they're trying to get out of it, obviously it's going to work out better.
Yeah, and I think what you just said, Ben, outcomes happen. The worst thing you can do for these is bury your head in the sand. Telling a patient, this didn't quite go as well, but here's how we're going to handle it. It's not admitting that you did something wrong. Sometimes the body just doesn't heal or doesn't heal the way you want it to. And it's a good thing to talk to the patients as soon as you identify those.
So we kind of touched about the bedside manner. Do you think that's something that you're born with, or is it something that can be learned?
I think the answer is both.
Yeah.
I don't think it has to go one way or the other. I think so you look at it and, I'll go back to podiatry school a long time ago for me. But I had a gap between graduating undergrad and podiatry school that I was a high school athletic trainer. And so I was seeing patients, working with people all the time, taking care of injured people, injured athletes, high school athletes, talking to their parents and stuff. And so then when I got into podiatry school, we get on those rotations, I kind of had that already in me. But there was, classmates of mine that had never had that right from undergrad into it, really didn't have that interaction. But some of them are the best doctors that we have in our profession and do well with it. So I think the answer is both, and I can see it on both ways. So sometimes it's innate to you. Sometimes it's that you can learn. I don't necessarily I think you can always learn to get better on it, and learn from your mistakes with it. But I don't think you can say there's just some doctors that are just never going to have good bedside manners in any way, shape, or form. I think you can absolutely change yourself.
Yeah. And I think there's little things that you can learn along the way. We're always told the worst thing you could do at the end of an appointment is have your hand on that door handle. The patient knows you're trying to get out of that room as fast as you can. I catch myself doing that all the time and make myself stop. And one thing I picked up, there was actually a study that looked at patients' reactions or feeling the interaction with their physician if the doctor is standing versus sitting. So I make a point that I always sit in the room because patients feel like you're on their eye level. You're not staying above them, not talking down to them, and they feel like they're more involved. So you can certainly learn little tricks from people. Naturally, we know people that can talk to a wall, and I'm not one of those people, but ironically, in clinic, I could talk to patients all day long.
Want to receive a monthly newsletter with topics from the Insured Connection? Head over to picagroup.com/Insured Connection and join our email list to have it delivered right to your inbox.
Yeah. One of my attendings, he'd be very efficient, very fast, but patients felt like he was in the room with them for like 15 minutes, even if he's only in there for a couple minutes. So it really is just, how you can carry yourself. And I agree with Jeff. I think it's, there's some nature versus nurture. Some people, it probably it's more intuitive to and more innate, but it's a skill like anything, something that you can develop if you work at it. One other thing is the healing touch is something that I came up or that I saw from attendees. Basically, when you're talking to a patient, something's going on, you put a hand, on their foot and your leg, just kind of, or you'd see them in the before the surgery, you put a hand on their shoulder, just kind of a little bit of that connection and really go a long way to, make them feel confident with you.
During COVID, I had a hard time because you not be able to touch patients. I'm a handshaker. I like to handshake. There's some patients that even hug me. I try not to hug too often, but there's a couple I've known them like for 15 years now, and basically in my family. That touch component of things is really important.
Do you think patients expect something different from male physicians compared to female physicians? Is it a different dynamic?
I know there's been a woman's podcast, so I don't want to take over on that to say it, but married to a female surgeon, I get the other end of it. the advantage we have on this is like the nurturing that patients expect from a female doctor is so much more. Like Dustin talked about getting out of the room, like a female physician has an inability to get out of the room and they have 8 million things going on. And we can walk in as a male and kind of say, what are you here for? Tell me what your one thing is. And they're like, okay, he said it's one thing and that's all I talk to him about. And they don't have that luxury in terms of some female physicians have to deal with everything, even potentially outside of what their appointment was for. So I know it's difficult for female surgeons and physicians to really hone things down. So that's kind of my comment on it from getting information back in the household about how there's some differences.
All right. Well, speaking of relationships, so those relationships that involve a spouse who is in healthcare do feature unique challenges. So we got long hours, sometimes really significant stress at work. Do you think being a male physician makes it harder or easier to be in a relationship?
I think probably much easier for us. We all have children, so we've seen what our wives have gone through to have when they're pregnant, when they're raising the children. So yeah, I think it's night and day easier for me than what my wife goes through. I might have longer hours than her and she works too, but, you know, obviously I wouldn't be doing what I can do outside of my regular job if it wasn't for her allowing me to do so by taking care of the kids. She just picked them up from a baseball game right now. Just heard them run inside downstairs. So, and I wasn't able to do that. So, absolutely easier from a work perspective from us.
Yeah, I'm blessed to have a wife who was in the emergency department. I feel like, a spouse who is in the health field is going to understand, you quite a bit better. There's certainly the challenge of like you have that hard day at work, but you come home and they've been with the kids all day, and then it's your turn to be on as well. So you kind of have to take it for a grain of salt to a certain extent. That you still have to have that second part of your life that demands equal as much attention.
Yeah, there's a lot of people and even a lot of just podiatry relationships that we see and we meet. And there's more now that, since I've been married for the last 10 years that we meet people that are married, and it's a shared responsibility. And we all have things kind of going on in terms of even outside of your practice stuff that's involved with podiatry. And it's just finding that happy medium, and currently, and it can swing. And currently now my wife works way more long hours than I do. And I kind of do the role of pick up most of the times during the week and drop off. And then other days that she does. But I think the big word that you brought up, Ben, and in a medical relationship is the understanding makes it easier. So there's definitely an understanding that it's there as the reasons why, you're not there sometimes and you are sometimes. And it's even tough on the kids aspects of it in terms of, our son sort of gets it that sometimes both of us take call and there's sometimes that one of the two of us are not going to be there to put him to bed, but one of them are, and the reasons why one of the two of us are not there. So it's tough on the kids too, but it's finding that understanding and happy medium that works well for everybody.
We're all in our own unique situation and just kind of finding what works for you type of thing. So at this point, I want to open it up. Is there anything that we haven't touched on that you guys feel is important when we talk about men's health and medicine?
I think the one thing we missed is physical health as well as mental health. Taking care of yourself, get your checkups that you need to get checked up, heart, colon, etc. Make sure you're as healthy as possible from mental and physical side of things.
Yeah, from being the elder on this group here, and coming up on turning 57 this year, it's getting your annual physical. Keeping up on things, going to your primary care physician, not saying, I'm in the healthcare field, I'm healthy, but going each year, getting your regular blood work. Yes, there's no better time to talk about things, but this year, my hemoglobin A1C came back as 6.8 somehow, some way. Long story short, I have latent autoimmune diabetes in adults and just kind of popped up. So caught it early on, just monitoring medicine, no insulin, no medication, just know that it runs a little higher than normal. But that just kind of came out of nowhere. And I'd much rather have it because Dustin, like you said, in terms of getting regular checkups and otherwise, that I know about this where I didn't walk into the emergency room at 578 or something, or, had some issue that kind of came up that this built up. So this keeping up on things, regular colonoscopies, regular checkups, that just don't think that you're a tough guy and just nothing's going on and you feel healthy and otherwise, to get your regular checkups.
I mean, doctors are humans too, right? And it's one of those things that it's a slippery slope. You miss a few hours of sleep here, you go a few days without working out there, and you eat crappy there, and it's always important to just kind of try to get back onto the right the ship and get back into things. But if you're not healthy, then you're not going to be as good at providing care for your patients.
Absolutely.
And now I have empathy for my diabetic patients even more than
Side benefit, yes.
I fully understand. I had some back issues a couple of years ago and, got sciatica. I'm like, wow, like nerve pain really hurts. So I feel for you guys.
Yeah. All right. Well, I really appreciate everyone's honesty and insight today. These are conversations we don't always have, but probably should have more often. So thanks again for being part of this. And for the listeners, please do subscribe to the podcast so you can see more of these really cool conversations. Thanks, everyone.
And that's it for this week's episode. But let's continue connecting. If you're enjoying the Insured Connection, don't forget to leave a review on your streaming platform and subscribe now so you can connect with us each time we post a new episode. To stay connected with us throughout the week and to tell us topics we should discuss on future episodes, go to picagroup.com/insuredconnection.